Skinbooster doesn't just hydrate the surface of your skin. It works in layers that no topical cream can ever reach. If you've been researching this treatment, you've probably heard it makes skin look more luminous, more supple, more youthful. But no one actually explains the mechanism. How does it work? Who is it for? How many sessions do you need? And how long do the results actually last? This video answers all of that. From the science of how it works to real clinical protocols. This is your complete patient guide to skin boosters. What is a skin booster? A skin booster is an intradermal hydration bioactivator. More precisely, it's a product, typically a low-viscosity hyaluronic acid formulation, injected directly into the dermal layer to improve skin quality from the inside out. It doesn't fill. It doesn't add volume. Doesn't reshape contours. The goal is entirely different: to restore the skin's intrinsic ability to stay hydrated, elastic, and luminous over time. The hyaluronic acid used in skin boosters is formulated specifically to integrate into the extracellular matrix of the dermis, rather than forming a localized deposit like traditional fillers. It becomes part of the tissue architecture. The most widely studied products include Restylane skin boosters, Juvederm Volite, and Teosyl Redensity. Multiple clinical trials have validated their safety and efficacy profiles across diverse skin types. How it works in the dermis. When a skin booster is injected into the dermis, two key mechanisms are activated. First, direct deep hydration. Hyaluronic acid can bind up to 1,000 times its own weight in water. When deposited in the dermis, it creates a sustained hydration reservoir, immediately improving skin turgidity and suppleness. Second, fibroblast stimulation. The presence of HA in the dermal matrix signals fibroblasts, the cells responsible for producing collagen, elastin, and endogenous hyaluronic acid, to increase their activity. This leads to structural improvements in skin quality that extend well beyond the lifespan of the product itself. This is the fundamental difference from a topical moisturizer. Creams act on the epidermis. Skin boosters act in the dermis, where fibroblasts live, where collagen is made, where lasting hydration originates. Topical HA molecules are too large to penetrate the skin barrier in clinically meaningful amounts. Block 4. Who is it for? 5:30 to 8 o'clock. Skin boosters have a broad indication profile, making them one of the most versatile treatments in aesthetic medicine. Primary indications: dull low luminosity skin, chronically dehydrated skin despite consistent topical hydration, irregular texture, enlarged pores or superficial fine lines, loss of elasticity from aging or chronic UV exposure. Patients focused on skin quality maintenance, not volume correction. Skin affected by smoking or significant sun exposure history. Pre-treatment skin preparation before more complex procedures. Who can have it done? Adults from approximately 25 to 30 years old. There is no upper age limit. In fact, older patients often show the most dramatic results because of greater depletion of endogenous HA with age. Contraindications: pregnancy and breastfeeding, known hypersensitivity to HA, active infection in the treatment area, keloid tendency, active autoimmune conditions. Medical assessment before any procedure is essential. Treatable areas: face, particularly cheeks, periorbital area, and temples, neck, décolletage, hands. Sessions and protocol. Skin booster protocols are individualized, but there is a well-established clinical standard. Induction phase: 3 sessions for weeks apart. This spans approximately 3 months. This is when the majority of biostimulation and deep tissue rehydration occurs. Maintenance phase: after induction, 1 session every 6 months is the standard recommendation. Some patients, depending on skin condition and age, maintain results with annual sessions. What to expect during treatment: application is via microinjections in a retrograde or point-by-point pattern, typically following topical anesthetic application. Most patients experience minimal discomfort. Mild redness, a sensation of fullness, and small papules at injection sites are normal, all transient, resolving within 24 to 72 hours. Most patients return to normal activities the same day or the following day. Results. What to expect and how long they last. The most common question: is it worth it and how long does it last? Skinbooster results are progressive, not immediate. Within the first week after each session, most patients notice improved luminosity and a change in how their skin feels. But peak results are typically observed 4 to 8 weeks into the protocol, as collagen biostimulation and dermal matrix reorganization reach full effect. Documented improvements include skin hydration levels, measured by corneometry, elasticity and firmness, surface texture uniformity, radiance and glow, reduction in superficial fine lines, duration Clinical studies on leading products demonstrate results lasting 6 to 12 months per maintenance session. Patients who complete the full induction protocol and maintain regular sessions tend to see cumulative, long-term improvement in skin quality over time. Important context: skin boosters don't replace other procedures. For volume loss, fillers are indicated. For laxity, collagen biostimulators or energy-based devices are the right tools. Skin boosters treat skin quality, not quantity. To summarize, Skinbooster is a low-viscosity hyaluronic acid injected into the dermis to improve skin quality, deep hydration, luminosity, elasticity, and texture. It works because it acts where topical products cannot reach, inside the skin, stimulating fibroblasts to produce more collagen and endogenous HA. It's indicated for dull, dehydrated, or aging skin, and for anyone who wants to actively maintain skin quality over time. The standard protocol is 3 initial sessions followed by maintenance every 6 months. Results last 6 to 12 months and deepen with consistent upkeep. If you're considering this treatment, consult a qualified practitioner. In-person assessment is essential to determine the right product, protocol, and realistic expectations for your specific skin condition. If this video was helpful, hit like. It genuinely helps this channel reach more people looking for evidence-based answers. Drop your questions in the comments. I answer, and your question might become the next video. And if you want to go deeper, I've put together a complete reference guide on the most common aesthetic procedures, with plain language, scientific grounding, and a practical checklist for your next consultation. Link in the description. See you in the next one.